COVID-19 frequently asked questions, particularly about pregnancy. Hi, I'm Dr. Jen, the OBGYN, and in my last video, I gave some information about basic things to know about COVID-19. Whether you're pregnant or not, hopefully that information helped you navigate how important exposure to this virus could be to you and your family. Today is Thursday, March 5th, 2020. I presented this information yesterday to a group of school officials and decision makers in a northeastern United States school district, and they had some great questions. They encouraged me to share my answers online. I also can't forget the questions pregnant women ask me, so here we go. Will warmer weather make COVID-19 disappear? The answer is we really don't know yet, but if experts had to guess, they're thinking probably not. The reason has to do with the fact that when we look in the past to other coronaviruses like COVID-19, SARS in 2003 will come up as something that we can compare it to. And it did not go away on its own as the weather got warmer. That only went away with intensive public health interventions, isolation, quarantines, other intensive efforts. But what we have working against us is that COVID-19 has a much longer incubation period, meaning that people really don't tend to get much in the way of symptoms after they get the virus, sometimes for up to 2 weeks before people understanding whether they have it or not. Sometimes even when they get those symptoms, they're so mild, people don't realize they ever had it at all. So the fact that SARS had more severe cases that could be identified and could be taken out of the population to heal, and their incubation period was a lot shorter, that was part of what worked to remove SARS from the population in a way that we haven't seen a case of SARS since 2004. The second reason why warmer weather may not make COVID-19 disappear is the fact that that's the description of a seasonal virus. And COVID-19 right now is a brand new virus to everyone, and no one has any immunity to this virus. And when we see viruses brand new in the population that nobody has any immunity to, they just don't tend to act seasonally. So what do experts think will happen? Well, it looks like there's what they worry about happening, which I'll describe here, and then what they hope will happen, which I'll describe in the next slide. What they worry will happen is that, especially because over 80% of the COVID-19 cases are mild with this long incubation time, they're worried it's going to be pretty easy for it to spread in the population. Some experts actually are concerned that about 40 to 80% of the world's population will eventually be exposed to this virus. And that's why efforts for looking for treatments and developing vaccines are developing regardless of what happens today. So if this is already starting to see a community spread, why isn't this being called a pandemic yet? And the answer to that is that countries have pandemic plans in place that are launched when the WHO uses the word pandemic. And what happens in most countries then is that they go from a containment strategy where quarantines and isolations happen to a mitigation strategy where something called social distancing happens. Social distancing is where basically areas where people congregate are made so that they don't exist anymore. Things like sports functions canceled, theater shows canceled, festivals, conferences. Children who would normally be at school are told to go home and study and do homeschooling from there or distance learning. Even some businesses are closed in areas where people would congregate for work. What the WHO has found, though, in the fact that China has actually seen some success in containment of the virus is that both containment and mitigation seem to be working hand in hand in order to help control the spread. So the WHO doesn't want to say the actual word pandemic because for some countries, they'll stop containment and only go to mitigation. And the WHO really wants the countries using both now. And that seems to be what most countries are doing. So pregnancy questions. The information for these pregnancy questions can be found online with the American College of Obstetrician Gynecologists, and I am a fellow in that college. So first question, are pregnant women more likely to get the COVID-19 virus? A little background, pregnant women in general do have a decreased immunity, meaning that it's easier for pregnant women to get any kinds of infections, anything from the common cold to influenza to very severe illnesses that are infectious in nature. Pregnant women are more susceptible. It's part of the reason why obstetrician gynecologists have the conversations they have with pregnant women about getting things like flu vaccines during pregnancy, etc. So based on limited data from prior coronaviruses like SARS and MERS, and even the small amount of COVID-19 viruses cases that we've had in pregnancy that have been studied, it does look like pregnant women are again at higher risk of severe illness, morbidity, mortality, and that's compared to the general population. Even adverse infant outcomes like preterm labor look like they're more frequent in these populations. Now, to be fair, they're not sure whether or not it's directly a cause of the virus or just the fact that women who tend to get the virus also tend to have poor pregnancy outcomes. So they're still studying. The second question is, are pregnant women who have the COVID-19 virus passing this on to their unborn babies in the womb? And the answer there is we just don't know yet. Now, again, to be fair, this virus has only been around for women in the third trimester who have delivered that we can look at their newborn infants. We don't know anything about second trimester mothers. We don't know anything about first trimester mothers yet. But the third trimester mothers who have delivered, we do have moms who have delivered babies that have no virus. And it looks like there are some cases of babies who do have the virus very soon after birth, if not immediately at birth. But it's uncertain whether or not the moms who have the COVID-19 are infecting them through the course of caring for the baby, or if it was something that they actually developed in the womb. So again, the answer is we just don't know, but we're still looking. The last question is, can pregnant women with COVID-19 breastfeed? Good news here is that we have not yet seen COVID-19 passing through the breast milk. So the actual breast milk itself should be okay. Some of the not so fun news is that for women who have COVID-19 immediately after birth, it looks like every hospital is going to be developing their own care plan where breastfeeding is concerned. And what the big concern is not passing COVID-19 through the breast milk, but actually the respiratory droplets of the mother onto the baby that may actually spread the virus to the baby in that fashion. So there may be everything from having moms wear masks to having moms do that in addition to pumping, and then having someone who is not infected administer the breast milk to the newborn. I know things like this are not fantastic news for moms who have the virus, but on the other hand, every hospital is different. We do understand the importance of the breast milk, and officials, nurses, physicians, pediatricians, everybody is going to be working with each mom on an individualized basis, depending on their care, to see the best way that we can get breast milk to the little ones. Reputable sources for information that I've found include the World Health Organization, Centers for Disease Control, Medline Plus from the U.S. National Library of Medicine, National Institute of Allergy and Infectious Diseases, and for those who are looking for any and all information on alternative treatments to the COVID-19 virus, and here's a preview of the website. They haven't found any so far that are effective, but if you're looking for things in real time, you can look at the National Center for Complementary and Integrative Health from the U.S. Department of Health and Human Services. If you liked this video, please give it a thumbs up. If you loved it, please subscribe. And if you're interested in any new information about COVID-19 from me, please text COVID-19 to 44222 and give your email address, and you'll be put on the email list and sent the information when the next video and information are out. Thanks very much for watching.